Awesome. Well, welcome all. Thank you so much for tuning in or watching this later on demand, I guess as the lingo says. We wanted to have be able to present to our community some of the things that we've been working on, and especially what we're really excited to be launching is a new and far better, what we hope is a far better way for patients to be able to get a hold of us at the OHSU adult CF program. So, Joe, if you can advance the slide, please. So we're going to have a chat about a number of different things, mostly all centering on sort of connection, partnership, and communication. You'll hear from many of our team members, introduce some new team members, our patient partners, and our CF Advisory Council. All right, next slide, please. So a lot has happened in the last few years. Certainly Trikafta has been a new transformative therapy. We've had a pandemic. Our center has undergone some changes. We've got a lot of new team members, which we'll introduce later. And things have really shifted, especially because of Trikafta. And there's a lot less about, coming into clinic, measuring your lung function, adjusting some treatments, deciding if you need to, focusing on adherence, deciding if you need to come into the hospital. There's a lot more kind of non-pulmonary issues and a lot of folk transitioning to maintaining good health and striving for living a long time with CF. And that's sort of new for us, and it's new for patients too. And along with that, there's a lot less sort of symptom-based care, like, oh, I've got, a new cough or I'm feeling really down, to finding a lot of things that maybe don't have any symptoms. And with that, it's really important to have a sense of connection and a relationship with your CF care team, not just the provider or the doctor or nurse practitioner, whomever you're seeing, but really with the rest of the team. And as we've sort of got a lot of new team members in the last few years, we've really focused on building relationship-based care and having that be kind of the theme of our care program. Next slide, please. So we started a quality improvement program, especially with a change in the last couple of years, that was a coached program through the CF Foundation. And part of that was recruiting some patient partners who you'll meet here. First, we started with 2, and then we recruited another just recently that have been really helpful as we kind of went on this journey, this coach journey on really doing an assessment of our program, of what we are about, what we're trying to do, and what are the things that are making things not go super great. So with that, we've been meeting every week. We've got assigned roles. We've been focusing on not just, throwing around ideas in but actually keeping track of projects that we've been working on, sending out surveys, really trying to use information and data to improve what we're doing. So one of the first things we did was we launched a survey, and I'm going to pass over to Daniela as that a survey on communication was really informative to us. Next slide, please.
So that survey was a satisfaction survey about reaching the adult CF team member directly, the ease in speaking with someone, the time it takes for a staff member to respond, and people were able to kind of say not satisfied versus, all the way up to very satisfied. But there are 2 quotes that really stood out to us as a team, and we wanted to share them with you. The first one, I feel like I'm reaching out, but my message has lost its meaning by the time you receive it. Next slide, please. And the second one, the system is set up in a way that basically discourages, disallows direct connection with the clinic, which feels very isolating and unhelpful. Next, please. So first of all, we really want to let you know how much we appreciate your direct and honest feedback regarding your experience contacting our clinic, as it directly impacted our next steps. We were able to combine the feedback that we received from patients, from surveys, and the training that we had with the quality improvement to really highlight the need to focus on the importance of improving our communication between patients and providers. Next slide, please. So without further ado, this was a year-long process. We probably learned a lot more about IT things and call flows that any of us ever wanted to do, but we did it. So this is our new direct number. This allows you to reach each team member directly, and our new number is 503-418-6500. We were able to choose our number. So we obviously chose the number 65 in honor of 65 roses. And I want to make sure most of us know that 494 is an OHSU number. 418 is kind of the silent second OHSU number. So when you receive a call from either 494 or 418, they are both OHSU. This also gives you the option to contact the person you are looking for the first time you call, which is quite different from our previous process that we've had for a long time. You can also still call the number that we all know and love and have memorized on the back of our hands, 503-494-1620. And then you'd select option 2, and that would get you into our new phone line system. So let's talk about what it looks like when you call. Next slide, please. So when you call the new numbers, whether it's 6500 or 1620 with the option 2, you'll be greeted with a thank you for calling the Adult Cystic Fibrosis Clinic. For existing patients, press 1, or new patients, press 2. So we wanted to just kind of further explain what a new patient or existing patient is. A new patient is obviously someone who has moved centers, moved across the country, someone who was just recently diagnosed with CF, or it also includes those who are transferring their care from Dornbecker, that it qualifies as a new patient. You would then be connected for someone to schedule. This includes referrals and insurance and registration. So it's a little bit different than the traditional schedule and appointment option. For an existing patient, this is someone who has already been seen in our clinic, whether it's telemed or face-to-face. And then that will get you into the option to select your specific team member that you're looking for. Next slide, please. So these are your phone line options. Option 1 is to schedule an appointment. This is the front desk staff that everyone is used to speaking with when you first call 1620. So this is pretty similar. And then option 2 is definitely new. So you would hit option 2 to speak to Ash, our nurse. This would be for sick calls and advice. Option 3 is Melanie, our pharmacist. This would be any medication questions or needs. Option 4 would be our social workers, Alana and Jared, and our wellness coordinator, Colleen. You would select this option for any patient resources, any mental health support. Option 5 is Kim, our respiratory therapist. Any respiratory equipment needs or scheduling your home PFTs. We are still doing telemed visits, and Kim definitely handles that very important piece. And option 6 are your dietitians, myself and Carly. So you would press that option for any nutrition needs or tube feed changes. Next slide, please. So expectations for the new phone line, it is literally kind of for lack of a better word, a phone tree, right? So you get an option and it forwards you to another number. More than likely, you will probably leave a voicemail just given clinic time or meetings, but we are going to kind of follow the standardization that OHSU has. If you call before 3 p.m., you should expect a return call the same day. Sometimes when you call, you might be connected directly with someone, which would be great. That is definitely our goal also. For holidays, weekends, and after hours, you will be connected to the hospital operator, just very similar to how the existing 1620 is. When you are connected to the hospital operator, you have an option to leave a message for clinic staff, or if you have any urgent medical advice or needs, you would be able to speak to the pulmonologist on call. Little side note with our existing number 6500, if you call 6500 after hours right now, it connects you, it rings, and it connects you directly to the hospital operator. We've all been testing this. I feel bad. I think I've hung up on the hospital operators quite a few times, and sometimes I've said, oh, hi, just testing a phone number. We are hoping that it eventually will mimic exactly what 1620 is. It kind of gives you a couple lines and then gives you an option to connect to the operator. So just a fair warning right now, if you call 6500 after hours, it rings and you've got a live person. I know most of us probably expect the standard greeting. And we're really excited about this new phone line and this new phone system. We hope you are too. This phone line was really created because of your direct feedback. We were able to create something that we truly believe and hope is going to improve communication between you and the clinic. And we can only continue to improve things with your feedback. So please, let us know how things are going, because we want to know and we want to improve all the things that we're doing. And now I'm going to transition it to Ash.
Thanks, Daniela. For those who don't know, I'm Ash Swift. I'm the nurse here, also the program coordinator for the group. And I am going to talk today about a program that we also took part in addition to the quality improvement year-long project. We did some extra training in something called the Partnership Enhancement Program, or PEP. Next slide, please. So we are committed to being strong partners with you and your family to support your health and well-being. To do this, it's important that your care team, that we provide an environment that encourages sharing with each other so that we understand your needs and work together in meeting your care needs. So we engaged in the PEP training program to learn communication skills and build on skills that we already had to help us to be the best partners possible. Next slide, please. PEP teaches relationship-centered care and communication for CF care teams. It stresses techniques to keep in two-way information sharing rather than one-sided conversations. Sorry, guys, my notes are a little messy. It was developed in partnership with the Academy of Communication in Healthcare, and it is an evidence-based communication training. It was extensively tested in the CF community. Training is delivered by certified clinician facilitators in an in-person workshop or by Zoom. And in our case, we did both. To date, 985 care team members at over 75 care centers have been trained. Next slide. The road to PEP. The Cystic Fibrosis Foundation conducted research that resulted in people with cystic fibrosis, families and care teams wanted to improve conversation. The illustrations show that we can feel like we are talking past one another instead of connecting on issues, where we discuss different perspectives and mutually develop a plan. The people with CF, as the slide shows, and care teams, they cited a need for better conversations around all kinds of different areas. And that included the physical, mental, and emotional health, social and economic challenges, preparation for transition to adulthood, and sustaining daily CF treatments. These were all those bigger changes that we were mentioning earlier when saying that there was a lot of change in CF care. Next slide, please. The good news is that relationship-centered communication enriches conversations and leads to better outcomes. The literature shows effective communication improves patient outcomes, as well as outcomes for physician satisfaction, where most of the studies are done, and institutional patient satisfaction scores. Next slide, please. So the more we strengthen relationships throughout the entire system with effective communication, the more improved our outcomes will be. So PEP offers a tangible relationship-centered communication and builds skills that emphasize respect and openness to understand another perspective. They help the care team understand the impact of treatment on people living with CF and their family. This slide shows a real-life example of the importance of understanding the context of their lives, shown here with different perspectives on treatment plan. On the left, you see what we see on the clinic side. It's do your airway clearance twice a day, aerobic exercise daily, inhale tobramycin, and so on and so forth. And then on the right, you see what the list actually looks like in the day of a life of a person living with cystic fibrosis. Everything in yellow is a part of the CF treatment plan taking place between 6 a.m. to midnight. So this helped the team understand what the impact was of the treatment plan and set the stage for co-production of care. New perspectives lead to new conversations. Next slide, please. The PEP program is made up of 3 skill sets: establishing trust, creating an open dialogue, and partnering. I think there's animations there, so I think you have to click. There you go. By strengthening these skills, we improve our ability to acknowledge and address what is important to people with CF and their families, gain an understanding of and acknowledging their ideas and values and preferences, whole identity and emotions, and engage in stronger collaboration to create and confirm the next steps. Next slide. So this slide shows what are some of the key PEP skills. So you may notice when you come into clinic now, instead of us asking yes or no questions, we may ask you an open-ended question. And what that does is it really helps us to understand your priorities, and it provides insight into the impact of treatment on your daily life. It also allows you to share your thoughts, feelings, and ideas without us closing that down with either a yes or no question. We're practicing more active listening. And what this does is it tunes us into your experience with CF. It reminds us that you're more than just your cystic fibrosis. And sharing information. It reminds us that a little bit at a time goes a long way. Take a little chunks, not the whole thing. Helps us ensure that we are sharing information in a relatable way and gives us both time to absorb and reflect. Next slide. All right, so the PEP skills can also help people living with CF to enhance their self-advocacy. So what that means is sharing what matters to you and sharing your perspective and emotions, and also create and confirm a shared plan of care. So something that a person living with CF can do, or a support person, family member coming to the clinic, prior to coming to clinic, prepare a list of questions and concerns for all care conversations to share with your team. Provide us your perspective on expectations. What are your preferences, your ideas, your values? We really actually want to know. Let us know how you're feeling about it. What are the emotions associated with managing your CF? What does it look like for you? And then before ending any conversation, make sure you understand and that you agree with the next steps. Don't just tell us yes, because we'll think that we're just amazing, but we want to really know if you are on board with what we're talking about. And if you're not, or if there's something in the way of making that care plan happen, we want to know and try to problem solve and come up with a compromise. And with all of that, now we're going to meet our new team members.
Hi, everybody. My name's Beth Collins. I'm a third-year fellow here at OHSU, and I've been working intermittently in the CF clinic with Dr. Trimble since residency. I grew up in Oregon and left for a little while to go to medical school in California, but I'm happy to be back here and looking forward to joining the clinic as faculty this summer. I know I've met some of you already, and I look forward to meeting the rest of you in the coming months.
Hi, I'm Melanie. I'm the clinic pharmacist on the team, joining the team about 9 months ago now. And I'm originally from the Bay Area. Went to pharmacy school out there and then completed my residency training at UC Davis in Sacramento, California, which is also where I gained my first experience and exposure working with the CF community. As the pharmacist, my role is to help with all things medications. So this includes medication management, answering any questions about side effects, drug interactions, indications, and dosing. And then also another big aspect is medication access. So if there are any issues with pharmacies or insurance or cost questions and access to copay programs and grants, I can definitely assist with any of that. My availability is listed on the slide, but just note that as there's technically only one pharmacist on the team at this time, I might not be able to see everyone in clinic, but my goal and my expectation is to check in with everyone at least every 6 to 12 months, and then as needed for any issues that come up. Next slide, please.
Hi, I'm Alana. I am one of the social workers, and I am at home right now and dog sitting. So you're going to hear some dogs yelling at each other. Yeah, so I've been in this role for almost 1.5 years, and I am here Monday through Friday, with the exception of Tuesdays. I typically tell people if you reach out to me, especially via text message, knowing that it's not secure, and I don't get back to you within an hour, I'm off. Can also reach me by the bat signal. I am from San Diego, California, moved up here in 2011, and it's been awesome. Finished grad school in 2019, started working as an inpatient social worker for trauma for 2 years before I came to this role. And I worked a little bit with Wendy. I knew her from my other job in the hospital, and she was amazing and did give me some of her magic tricks. So reach out to me for them. Next slide, please.
Hi all, my name's Jared. I can confirm Alana does respond to the bat signal. I've used it a couple different times. I joined the team last year around May, but I typically only cover clinic Wednesdays and Fridays. So usually, if you need to start a conversation, it's via email. The phone number on my business card also gets to Alana. So between the two of us, we'll figure out a way to respond. I grew up in Portland, been around for a bit. As far as OHSU, I joined in 2019, and most of that work has been in crisis and after hours evening coverage. So you see a bit, you've done a bit in those roles, but really looking forward to joining this team and having a little bit more consistency and the ability to build a relationship. So that's me. Next slide.
Okay, so as Dr. Trimble mentioned, he has invited 2, and now we've added a 3rd patient partner. Excuse the hoarse throat. My name's Willem Weary, and I'm one of those 3 patient partners. And we are really excited to be part of the OHSU Adult CF team. I'll introduce myself, and then we'll have Cindy and Rebecca introduce them in a couple minutes. Let me start off by saying that we were invited to join, particularly focusing on the quality improvement projects and providing the patient perspective in that project. And as Daniela mentioned, the whole phone tree was based on surveys and also some, other patient input, including what Cindy and I have provided. So we're really excited to see that we're going to have a better way to get in touch with our various providers at the CF clinic. So a little bit about me. I'm 63. I was diagnosed at 8 years old. I am just a few weeks shy of a 4 years on my double lung transplant. I'm currently retired, but in previous jobs, I've been an engineer, always in high tech, technical marketing, and spent most of my last 15, 20 years as a technology strategist. I like to say that, I've been at, I always joke about going to OHSU. When I first moved to Portland, I was one of the few adults, and we would sit in the pediatric clinic and watch the kids play while, I was 30, 35, 40 years old until we finally did form a CF adult clinic. So that was a comfortable relief. I am married to my wife, Kathy, seen here. She's very active in the CF community. We have 2 adult sons, and I am very happy to be Opa, grandfather to 3 beautiful granddaughters. So what do I and Cindy and Rebecca do as patient partners? Joe, the next slide. Our primary role really is to provide that patient view. And we have a lot of experiences from OHSU. We have experiences from outside of OHSU. Cindy has been in several different clinics. And so we try to provide the team like, hey, this is what's impacting us, the patients. And what we've done is we participate in the weekly care team meetings where we talk about our QI projects, and we really have the focus on improving patient care. We are also participating in, as I mentioned, the QI project, but also as Ash talked about, the whole PEP program. So we were the active patients in there and working with the team on that. And we are busy with suggesting ideas. We share our personal stories. We are actively researching options and researching our phone tree when it doesn't connect at night. and we ensure that the QI projects are really patient-centered. So that's our job, and that's what we do on the CF adult team. With that, I'll hand things over to Cindy. Next slide.
Hi, my name is Cindy Baldwin, and I'm another of the patient partners for the OHSU CF team. I am 34. I am a children's book author. You can see some of my books up on the wall there. And I have been a patient at the OHSU Adult CF Center for 8 years. I actually grew up in North Carolina and attended both the UNC and Duke CF centers there. Then lived in Idaho and Utah for a while and attended the University of Utah CF Center. And then I moved here and switched to OHSU Adult CF. I'm also married, and I live in Hillsboro with my husband and my daughter, who is 10 years old, and her name is Kate. Can I get the next slide? So I wanted to share a little bit about some of the projects that we've specifically helped with. Willem and I have been patient partners on the CF team for a little over 1.5 years at this point. And we have had the opportunity to help with a couple of different QI projects along the way. The first thing that we did, which I know that we've already talked today about, the new phone menu and the new phone number that is debuting. That grew in part out of conversations where Willem and I had the opportunity to share our personal frustrations, as well as things that we had heard from other patient friends about how hard it was to reach the care team via phone when it was needed. And we were able to help brainstorm ideas and to design and implement and test the new phone menu. And I'm really excited about that because I, like a lot of other patients, had often felt frustrated and like it was hard to actually reach anyone on the team when I needed them to. And like, it was kind of like a giant game of telephone where I was trying to make sure the right messages got relayed to the right people. And it didn't always happen as quickly or as accurately as I would have hoped. Another project that we have been able to help on a lot is we have done a couple of different projects in the realm of sexual and reproductive health for CF patients, which is something that I think Willem and I are both particularly passionate about because we both are parents. And so we both have had, different experiences navigating sexual and reproductive health with CF and family planning with CF. We were able to share our own experiences with family planning, both our positive and negative experiences with family planning and with the interactions we had around that with care teams at the time, and kind of share like, what is the support we would have liked to have from our team. And we've been able to help design and implement a couple of different projects so far around sexual and reproductive health, both to improve communication between patients and providers, and to be able to improve education for patients so that they are armed with the tools to safely do family planning and have a healthy life in all avenues concerning sexual and reproductive health. And I now am going to turn the time over to our newest patient partner, who we're really excited to have, Rebecca.
Hi, my name is Rebecca Donahoe. I am 26. I have been at the CF about 5.5 years now. I started out at Dornbecker and transitioned to the Adult Care Center at 21. I am a registrar at my emergency department. And currently working towards a career in public safety. That's something I'm very passionate about. I do not have any children, but I do have a 2-year-old dog who is she is right now. And I became a patient partner about 3 months ago. I was approached and asked to become a part of the team to help kind of improve the experience and dialogue between CF patients and the care team when it comes to inpatient care. There's been a lot of positive, but also a lot of negative feedback when it comes to kind of what CF patients go through in the hospital. So we're working on trying to better improve the overall experience and dialogue within the community. Next slide, please.
Hi, I'm Maggie Lewis, and I'm joined with Jennifer Myers. We're both CF Advisory Council members. We're looking for more patients to join our advisory council. So I have been involved with the Dornbecker Advisory Council and as well as the OHSU Advisory Council. I have a 29-year-old son with cystic fibrosis, and I've volunteered in various aspects to facilitate conversations between patients and their care team. So Jen, go ahead and introduce yourself.
Hi, I'm Jen Myers. I'm 39. I was diagnosed just shy of my 2nd birthday with CF. I started out at Dornbecker's when I was a child and then transitioned to the adult side. We celebrated 8 years post double lung transplant in February, and then I got COVID. So hence the oxygen, hopefully things will return back to normal. But yeah, I'm also one of the members of our CF Advisory Council. And like Maggie said, we would love to have new members join our team and come up with some new ideas and new projects. Kind of what we were about is our aim is to represent the patients at the CF Care Center or OHSU and help pave the way for the best practices in CF services, educate patients and their care partners, and help patients achieve their best health outcomes possible.
Some of the ways that we've done that is that we try to contribute monthly to the listserv. We have encouraged the team to seek out trauma-informed care training, and that's been ongoing for the last few months, because we understand that the lifelong treatment of cystic fibrosis may have some very significant triggers to trauma, and these become barriers in effective care. And so we want to see that everyone is taken care of that way. We've also looked at how the streamlining of your clinic visit can be improved. And we want to understand the patient's experiences as they live their life not in clinic and not as an inpatient person, but also we want to understand your inpatient experience and how you do in clinic. But we really want to have more perspective from patients. So we need to have more patients join the advisory council. We are a small group of patients and care partners and folks from your CF team. Mm-hmm. And then we meet once a month, and we do that virtually. And that seems to work out really well because we have people from all over the state that join the meeting. And that's really important to know that there are different ways of approaching CF when you live 200 miles away. So we would like you to, we'd like you to get a hold of us, to ask questions, and to also express your interest in perhaps joining the Cystic Fibrosis Advisory Council at OHSU. But Jen, I don't know if there's more that you want to add on to that.
Oh, I was just going to say, yeah, reach out to one of us, or if you're in clinic, reach out to one of the social workers or any CF care team member, and they will put you in touch with us, and hopefully we will recruit some new members.
We're sort of listening to the patient partners and their perspective of the QI projects. It seems like we're the advisory council, and those patients that are offering their perspective to the QI process. We are kind of doing the same thing, although we're kind of a forward team. So we're pushing those questions and those projects to the members of the advisory council that are from your care team, and then they take that information back to the care team and to the QI team and say, oh, this is something that came up in the advisory council. This is a question. This is a perspective that we need to maybe pay attention to. So thank you.
All right, thank you very much. Well, all of you. So for the last little bit, I guess what I want to focus on is, or talk about is what happens when things aren't going great. So if our commitment and our vision is for really great relationship-based care and better communication and for things to be to really provide excellent care with that as the core, sometimes it's just not going to work out that well. And we've all, I think, all had experiences where things are just breaking down. And despite our best intentions, things aren't working very well. So that's what I wanted to chat a bit about, are really the options and the steps that, you know, we as a care team would ask of you. So Joe, next slide. So if you're having problems, of course, if it's with a particular, if there's a person who you're trying to get a hold of, please start with that person. If it's, but if for whatever reason, if you don't feel comfortable addressing that person directly with the contact information, whether it's through the phone or however, please contact me. I am the center director, and I wake up every day with the responsibility of providing, directing the care that every one of our patients receives. So I'm deeply committed to trying to make things as go as well as we possibly can. Doesn't mean I can solve every problem, though. If you don't feel comfortable talking to me, or if your problem is with me, OHSU has an office of patient relations, and this is not unique to CF. This is for any OHSU patient. If you want to speak with an advocate, we have several people whose full-time job it is to be patient advocates for inpatients or outpatients or whomever. Their email address and phone number is there, and I would urge you, if you're not comfortable speaking directly with us as a team, to reach out to the OHSU patient relations office. And lastly, if for whatever reason it's with OHSU or it just doesn't seem like that's quite right, the Oregon chapter, and Joe has offered to be a little bit more of, dare I say, last resort, I think, for providing more anonymous feedback to us if there's something that just is not going well, and it's really uncomfortable to reach out to someone at OHSU. The Oregon chapter can provide anonymous feedback and direction to us when things aren't going well. I hope that doesn't happen, but it's really my desire for us to do the very best that we can. But the chapter has graciously agreed to serve in that role should the need arise. Next slide, please. That was what we had to share, and I sincerely appreciate you all, everyone who shared, both from our patient partners and CFAC, as well as our team. And I'm going to hand it over to Joe, who's going to share a bit from his team.
Thank you, Dr. Trimble. I asked if it would be possible to share a slide at the end of the call here, and so I made 6, but promise to be fast. You know, you give an inch, take a mile. That's kind of the secret of any good fundraising, so I really appreciate it. But I do want to thank you for this opportunity, Dr. Trimble, and you have been such a fantastic advocate for our work. I love what you said about having the responsibility of directing the care, because you know, this man really does, and your whole team goes above and beyond. Just this week alone, I think Dr. Trimble was on 3 of our CFF calls after hour for various board meetings and events. So we are very grateful for this opportunity. I promise to be brief and talk quickly, but slowly enough that I don't get ahead of the closed captioning. So sorry about that failure there. We'll work on it for next time. This is our team here at the local chapter of the Cystic Fibrosis Foundation. We cover all of Oregon and Clark County, Washington. So from left to right, we have Lindsay, Jenny, myself, and Allison, this great team here that is just eager to support and looking for all of the volunteer engagement we can get. I know I'm preaching to the choir a little bit here, because the majority of people I know on this call are already so involved in various avenues of ours already. But I did leave a link in the chat, if you would be so kind as to give it a whirl. It's basically a volunteer interest questionnaire. And I think the big thing is if you're able to forward that on to any of your contacts. We are definitely experiencing a shortage of volunteers, not only event participants, but those day of volunteers and in-office volunteers as well. So there's really an opportunity for everyone, a program or an event for everyone that we offer. These are some of the national programming campaigns that I'm sure many of you are familiar with. Obviously, our Compass program, which is a one-on-one service to help people with CF and their families navigate various issues, insurance being a big one. Also, we have advocacy opportunities. You could be a passive advocate and sign up for advocacy alerts. We also have some opportunities within the foundation to actually advocate with state and national reps through various events. We have a Teen Advocacy Day and a March on the Hill as well. So great opportunities there. And then these two, the top right here, Tomorrow's Leaders and Grampians, these are programs that we have specific for young professionals and not necessarily CF grandparents, although that's certainly the case, but people that identify as a grand person. We actually have an event tomorrow morning. We're starting our first Grampians Coffee Corner in the office on Fridays. We're not quite sure what the cadence is going to be, but Friday, 10 a.m. tomorrow, we'll have welcome some of our Grampians or potential Grampians to visit. And then our Tomorrow's Leaders program is really for young professionals. We're tapping into our resource network of professionals through our advisory board and beyond to kind of help young people advance their careers. And so we're looking at some more engagement opportunities throughout the year. There are also national opportunities as well. I know many of you are familiar with Community Voice, which is a virtual opportunity for people with CF and their family members to share experiences and their perspectives. I didn't have it on here, but also we have our CF Peer Connect program, which I know is pretty popular locally, where you're connected with another person with CF one-on-one, and in some cases, small groups. And then, of course, there are our fundraising events. Great Stride season is upon us. As you very well know, May is Cystic Fibrosis Awareness Month. So this is a huge time for us. And for Great Strides, what I'd love to say is, if you are intimidated by doing any sort of fundraising, please still come out to Great Strides and just experience that community. We can always use volunteers as well. We're a little bit limited in what people with CF can do to volunteer, but there's opportunities for everyone. And we just welcome you. And like Dr. Trimble said earlier, hoping for some great weather. So we have the event dates up on here. And our Extreme Hike is a new event we started 2 years ago, and we actually have two opportunities this year: a one-day hike in Forest Park in Portland, and then a 2-day hike at Mount Hood on the Pacific Crest Trail. So these QR codes, I tested them out earlier, and they actually do work. So I don't know if we have the record, you can go back, but cff.org is always a great opportunity to learn more about what we're doing, and you can find our local chapter that way. In the summer, we have CF Cycle for Life, which is a recreational ride in Willamette Valley wine country, starting and ending at Lady Hill Winery. We have a lot of fun in store this year. Maggie wood-fired pizzas this year at the end, some great music. So $75 flat fee to ride in that. I think it's a slamming good deal. And that is, oh gosh, July 22nd. And a new golf event out in Oregon City at Stone Creek Golf Club, CFF Golf for a Cure. Last year was our first event, or first year out at Stone Creek, which was a lot of fun. Later in the fall, we have our CF Climb, or our Portland Firefighter Stair Climb Challenge. We recently opened up this event to non-firefighters. These two events are indoor, so a little bit limited in what we can do in terms of welcoming people with CF out of respect for our infection prevention control policy, but happy if you could spread the word on this. Many ways to get involved, always looking for auction items for our dinner gala, fun and exciting auction items. A couple years ago, we did we asked the community to contribute some items, kind of like a personal baskets, and people would get a theme or things that are important to them and meant a lot to them. And that was it was really great to see that level of engagement from the community. So and that is in October at the Portland Art Museum this year. Many of you might be familiar with our Rose Up campaign. Rose Up is a virtual fundraising event, and it is created and was created and is led by adults with CF. And the way it works is participants can choose an activity that's meaningful to them to accomplish on Rose Up Day. Recently was at a conference, and there was someone who said on Rose Up Day, they were going to say 65 dad jokes, which kind of hit home with me. I thought it was a good one. Of course, our own Cindy Baldwin on the call was our local Rose Up ambassador last year, and she had some book readings, some of her book readings on Instagram, which was a great fundraising event locally too. So that's a lot of fun. And then, of course, our Milestones 3, we have these wonderful events, but our Milestones 3 major gift campaign, there are a number of ways to give. We're in the middle of I think a 3-year campaign, and a little over halfway there, but it's unique this year in that legacy giving is a part of this campaign as well. So individuals who have indicated that they would like to leave some money to CFF in their will, those funds are counted towards this Milestones campaign as well. And then the other exciting piece of our individual giving is that we have the ability to restrict giving to certain funds that someone might be passionate about. Those funds include the Lung Transplant Initiative, the Nonsense and Rare Mutation Initiative, and Compass can also restrict to Compass. So many different ways to be involved. I'm so grateful for all of your support. Thank you very much for the invitation, Dr. Trimble. And if there's nothing left, I'll leave the last word to you.
Joe, thank you. You are hosting this event, and you have been, as always, such a super gracious host, and I really appreciate the partnership that you've and your team have given to us and to our colleagues and other centers. I guess I want to make sure that there's an opportunity for questions for those of you, if anyone's present here who wants to ask a question before we go. Of course, as always, reach out, email us with any questions you have. But feel free to either unmute yourself or drop something in the chat. We'll give it a minute here, and then before we close. Yes, call us. That's right. Thank you. On our new number, 6500, 418-6500. Well, we will leave it there. Please go out if you can, enjoy this beautiful weather. And I wish a happy Friday to you all and a great weekend. Take care. Thanks again.